Hi, I'm Scott Martin, and today we're going to interview Dr. Cammy Benton and talk a little bit about the long journey from 10 years ago to today. So welcome to your own show, frankly.
Thank you.
Yeah. So it seems a little odd because this is usually your show and you're usually the table to turn. And today we're going to kind of go back through the history lesson of like what's all happened. So congratulations on 10 years of business. That in itself is a pretty big deal. Um, let's start going through some questions. When did you first realize the conventional system wouldn't let you practice medicine the way that you believed it should be practiced? Because this is part of the origin story, if I understand, of what really has given birth to what you're doing today.
Well, the first inkling was my first year of practice, driving to work one day. And I just felt like I was just giving pills and then pills for those side effects and then pills for those side effects, and I'm like, there's got to be more than this. So I just remember feeling a little disenchanted the first year I was out. And then over the years, through lots of life experiences and medical misadventures, I I've got to learn something different. And so I started studying integrative medicine, functional medicine. And then pretty quickly, I could not do the 10-minute visit and feel that, I was getting anywhere to actually help the patient besides just checkboxing the quality of care metrics that the standard of care system has. And so, we have to, you've done your mammogram, you've done your colonoscopy and all those, but we didn't actually help the person with the back pain, the sadness, the sleep issues, the relationship issues that was actually causing physical manifestations in their bodies. There's just no time for that. So it's pretty early on, I felt like I didn't quite fit into that box.
So it was like so when you see the 10-minute visit, that's like a structural, typical way that clinics operate. Is that right? Correct?
Right.
Yeah.
Yes.
And then so what you're seeing is that by going through that structured process, it was overlooking what? Because it really, like, what specific moment did you realize that whole thinking, that structure was not working for you? Was there a moment, or is it just over time?
I would say it's over time, but pretty quickly. So the 10-minute visit is like literally, it's actually every 15 minutes that you're scheduled, but you're often double booked, triple booked. And then like I said, by the time you get in there, you're already behind because of how they have the schedule set up. And your patients are all waiting 45 minutes to an hour, and you're feeling rushed from the time before they even get there, you feel rushed. And the only time you're not behind is the first patient. Even then, by the time they pull them back, you're already 20 minutes behind. There was this race with time and patients' frustrations. And yeah, it just pretty early on, it was, it felt like a big hill to climb. And I was seeing 30 to 35 patients in an 8-hour day when we first started. And I'm tough and I'm fast, so I could do it. But it was very quickly that, like, even in residency, before I went practicing on my own, I could feel the pangs of something's not quite right here, but I couldn't put my finger on it, but because I had not had life experience yet as a physician. And I didn't grow up going to the doctor myself, actually. We didn't go to the doctor. We grew up in the country in North Carolina. And so I just didn't even have that personal experience from what medicine was supposed to be like, but something just felt off early on. And then I finally hit the wall about 2015. Actually, I hit the wall because my manager at that time, with no medical education, was coming in and saying, hey, you need to do this and this medical treatments for these Medicaid patients. And I'm like, you don't even have a medical degree, and you're telling me how to practice medicine. And it's like, I can't do this anymore. It's like, when I realized that I had tiers of patients that had more education or more access to care compared to those who didn't, I felt like I was being put into a corner of making decisions without true informed consent for those patients. Because they didn't have the time to really spend. I didn't have the time to spend with them to educate them, and I just I can't do it this way anymore.
So it kind of rubbed against your values. You're just like kind of going like, in the time being a factor, like people like cattle almost. So what is different? But what is Benton in response to that? Like, what have you this new brand that you're creating, and now after 10 years, what is it? Why what are you doing at time? Is it longer than 10 minutes that someone can visit you, or what have you revolutionized to respond to that constraint, if you will?
Well, I say on a patient perspective, there's a couple of things that they have. They have the frustration that they have to take off a whole half day of work just to wait for the doctor's appointment, and that even if their appointment's at 10, they might see the doctor at 10:45. And actually, in a lot of clinics, you only get to talk about one thing at one time, and then you have to make the appointment for the other issues because there's not enough time to manage all that. So we created a membership model. It's called direct primary care. Some people call it concierge. It's like depends on sort of the energy of it. Where we have a smaller panel. So I used to have like over 2,000 patients, and we had an on-call nurse that took like some of the triage calls. Whereas in my practice, you have about 300 to 600 patients, depending on which provider it is. And then they have our telephone number. So it's not that they call me all the time, but they use the portal. So if they have simple things like UTIs or colds or simple things that you can say, hey, just try this first. That allows them to get in for their concerns right away. Whereas in the insurance model, sometimes they can't these days even get in a timely manner, or they have to go to an urgent care or a minute clinic to go to see someplace else because they can't get in to see their primary care provider. And for simple things, you're like, wow, I've waited this long to get in. I've taken a half day off from work. The patient feels like if they don't get a prescription for that thing, then they've not gotten what they've paid for. Whereas when we take away that tug and pull of the co-pays and time and driving, we're just here to take care of you. And the goal is to get you into prevention mode. So if you've got a cold, we want right away to know, because we're going to tell you all these things that can prevent the sinus infection. Versus in the conventional system, it took them that long just to get in anyway, and they're holding on to the antibiotic. Right. It's probably gotten worse in this time, and they're just holding on. I want that prescription because I'm afraid if I don't get it now, then I'm gonna have to pay for another copay, or I'm gonna have to wait another week to get in. It's like it's an interesting tug of war between patients and the doctors in the conventional system that you don't have in this model that we have here at Benton Integrative.
Wow, that must be like like a frustration that's fairly pervasive. What's been the response? It must be overwhelmingly exciting about it. The piece that kind of strikes me that you're doing that I didn't hear that was happening before, which is the immediacy, the on-demand access of at least being heard, getting some sort of like relief up into the appointment as a mid-step to the full appointment. Is that kind of what the vision of this integrative, approach is?
Right. Yeah, it is. It is that, prevention is where it all is in primary care anyway. So the goal is that it's not that you just have a treatment. It's like, what can you do to support your immune system? What can you do to support your body through a process? And the word doctor comes from docere, which means to treat in Latin, to teach. And so I'm here. My goal is to teach you to not need to see me. That is truly, since I've been in practice, gosh, even when I first went into practice, like back in 2005, I remembered at first like upsetting people because I'm like, hey, this is a cold. This is how you treat the cold. They're like, I just want the antibiotic because they've been trained in a system that they feel abandoned. And so then I just teach them. I take a little extra time to teach them. And I was like, you might not need to see me again for this for years if you learn how to manage this well. So that is my desire, is to empower people to learn how to take care of themselves. There's been really an industrialization of medicine in the last 100 years. There's a lot of great things that has come out of medicine in the last 100 years, for sure. But part of it is the over-reliance of someone. It's like you're giving your power over to a doctor or a nurse practitioner when it's really your body, getting to know your own body and trust that your body was divinely created to get well when given the proper, environment, maybe nutrients or support. And so I want to teach you how to do that, and you won't even need to see me. Like, that's actually my winning day, is when you're like, wow, I really don't need to see Dr. Benton anymore, and this is great. I celebrate that versus the constant requiring of you have to come in and you can't trust yourself, or you're going to get sicker if you don't do this. It's just an interesting psychology there.
So I heard a lot of coming in to see me. That's the origin story of your brand, because it was called Benton,
Benton Integrative.
Yeah, that was the original name was Benton. We're at your 10-year anniversary. It's now not just you. There's a multitude of practitioners now. Can you talk about that transition from when it just started from you to what it looks like now?
I honestly, when it opened up, I thought it was going to be like a little micro practice. And I was just desperate to get out of the system. I was like, I can't work here another day. Like I hit my wall. I was like, I will do anything. And so I opened up a little practice, and gosh, it was maybe a 400 square foot room. It was so tiny. My desk barely fit in there. And And I filled up in a month and a half or two around there. I was like, honestly, it's kind of overwhelming how fast I built my practice. And I had to learn the business of medicine as well as like managing everything myself. And very quickly, I realized that there is a true desire for people to have this more compassionate care. So I hired someone else, and he filled up pretty quickly. And it's like we just keep going, and people are just hungry for feeling heard. Now, the conventional system works for some people. Some people really like how it works. They go in, they get the prescription they want, and they're fully happy with their system. But there's a growing number of people who want different care. And even I'll say at first, it kind of 10 years ago was very early on in the concierge direct primary care model network. And people are confused. They're like, wait a second, what do you mean I don't need my insurance? But I have insurance. Well, why would I not use my insurance? But when people start understanding how the insurance model helps to drive that very quick, like every 10 to 15 minute visit because of all the coding and all the requirements. It requires extra employees because you have to get all this stuff, approved when the doctor's like, I know this is what you need. And you have to jump through all these hoops. When we get rid of insurance, you have a lot more transparency, not only in the cost of your labs, but in what you're seeing with me and having me at your side. Like if you're on vacation and you've got a UTI, I'm taking care of you. I'm not going to sorry, I'm not going to abandon you when you're really in need. Or honestly, I've had patients die, like older patients. I have babies all the way up to my very elderly people. I've done home visits for newborns. I've done home visits for people dying. It's something that you just cannot get in the insurance system because I try to do home visits in the insurance system, and the corporation I worked for was not very happy because then that would take several hours of my time, which cut down revenue for them. And I remember even that first time was a patient who was on hospice, and he was nearly comatose, but he couldn't get hospice without the doctor's physical exam. And so when I had him come in, I didn't realize. And so the ambulance brought him in for me to examine him. And I'm like, wow, that was $1,000 ride to the doctor's office for a man who's comatose, who's dying. And just to get on hospice, like that's the last time that happened. And that was pretty early on in my career. So there are times where it is not appropriate to have to come into the clinic, and the insurance model requires that face-to-face to get reimbursed. So we don't have to worry about that at all. I'm just here to take care of you.
And so so you're one practitioner. All the practitioners share the same vision, values, process. It's not different by practitioner?
No, I would say I'm a little bit more of the OG, obviously, when you come in with this passion.
Your name's on the door, yeah.
Yeah, it's like you come in with this passion, this expectation of how things want to be. And so that is we train all the new providers in that mindset. Now, we obviously can't do home visits all the time because we're busy still seeing patients and everything, but we really, like there was a woman a couple months ago who she actually had a spinal injury, and same thing, she couldn't physically get to the appointment. So yeah, like that patient got taken care of in her home. So she could get the emergency care that she needed. She had to have a surgery up in Baltimore for that. So that's actually, we're there to make sure that patient gets the care they need, period. And that's the expectation of anyone working here.
For myself, like if I, do I have one, is it like I could go and visit any one of you, or do you have a dedicated practitioner or physician, or how does that work?
We each have our own panel. And just like when I just went to Peru the last 2 weeks, and so on my own vision quest, and so the other providers took care of my patients. But then outside of that, you get me, or you get used to your own provider. Now I am the only physician, the medical doctor here. We have nurse practitioners that are wonderful. And so we regularly meet about cases on a weekly basis. And if they have any questions, of course, I'm training them up. We call it the little fellowship here, that they're learning about homeopathy, nutrition, functional medicine. They're learning all the integrative modalities on a regular basis. So we have them doing trainings, but I'm always available here to teach them in that way.
Yeah. And then like just the fact you were in Peru, and of course, I have some inside baseball, if you will, about your business because I've been working with you. But I maybe share a little bit about you're constantly researching, innovating, exploring, all these different options. Share a little bit about that vision, because it feels like it never ends with you. You're always looking at something, and to maybe share that, because I think that's one of the unique benefits of over 10 years. Like imagine all the innovation you've created and what's yet to come.
Gosh, honestly, this started back in medical school when, again, I just had a feeling and knowing that, again, thankful for Western medicine, thankful for the ability to prescribe. But it's the what else could help before you, because like an antibiotic can really mess up your gut flora and cause yeast infections and other autoimmune issues. And there's all kinds of downstream effects of taking certain medicines, and a lot of medicines that are used commonly cause nutrient deficiencies. So I started researching herbal medicines and grandma's remedies. Honestly, I'm a family physician. So grandma's home remedies, like, really do often work. So I started learning there, but then when, like I said, my children and I, like, we experienced our own medical things and challenges, that I had to learn another way. It's like, because their bodies were not following the rules of what I had trained in. So that's what inspired me to learn homeopathy, functional medicine, more nutrition. And then as I went through my own midlife, I call it my midlife discovery, not my midlife crisis, but my midlife discovery of who am I? What am I here for? So then that's when I started learning Ayurveda, sort of energy frequency medicine, different types of therapies of how we can become a better version of ourselves. So I did a deep dive and everything, because I myself want to experience I want to experience what I tell people to do. So I try everything. Do you hear some feedback?
A little
I'm
bit.
hearing how that just suddenly came out from nowhere. It's kind of distracting. Do you know how to get rid of an echo like that?
Oh, do you have it? I don't have an echo, but I noticed when you first started that it sounded like there's a washing machine or electrical device that sounded, but you closed the door and I think it kind of helped you a little bit. But you an echo right now? Nothing, we didn't touch anything, so.
Yeah. All of a sudden it just came out. Now it's kind of gone.
Okay.
Strange. Anyway, all right. So,
It's the universe wanting to give a pause, that's all.
Yeah, just giving a
break.
pause.
Yeah.
I was like, it's like technology. Mercury retrograde is just over. So I'm still having issues, I think, from that. Anyway, so I want to know from my own experience how it feels with me. So then that helps me to understand, oh, well, maybe for your particular condition, this method might work better for you. I just know that Western medicine, conventional medicine, does not have all the answers. There's no one form of medicine that has all the answers. And not everything resonates with someone. Like, some people just don't want to do homeopathy. Some people don't want to do Western medicine at all. Like, so how can I broaden my ability to serve you and what your belief system is? Because there is the true placebo effect and there's the nocebo effect. The placebo effect means like 40% of people get better just because they believe it works. That doesn't make it less important. That means that your mind has the ability to heal just because you believe.
Right.
But the same thing goes with nocebo effect. If you believe it's not going to work, it's not going to work. And so people are all on a different spectrum. So even in my clinic where we're primarily integrative, we have people that are hardcore. They won't take a medicine for anything. Like, I'm having to, like, please, you got pneumonia, please take this medicine, to people that are, especially post-COVID, they're like disenchanted with the system, and they know that there's a different way, but they're still afraid to not go with the Western medicine. So as we're teaching them the different modalities, different possibilities, and whatever they feel comfortable with is kind of what they need at the time, even if it's not all natural. Like, we have different experiences and different stories around different modalities and what feels good to you and what doesn't. And be able to know my patient well enough to know what really that they are going to get better. But it's not about me. It's about what you need in this situation, whether it's natural or otherwise.
Do you provide the choice? Like, there's 3 different ways that we can tackle this. Which one would you want to go? Or are you going in intake form going, and you understand what they're looking for and you tailor it to that? Or both? I don't know.
It's both. I basically are, like, we give little handouts that gives, well, like, for instance, a urinary tract infection, you can try some D-Manos, here's a combo herbal medicine you can use, or here's your Bactrim antibiotic. And so we just provide, here's the choices. And so this way it empowers people like, oh, let me try 24 more hours of this, or I'll try this homeopathy. But if they're worse, they've got something right there. That way they're not putting themselves at risk, but it gives them the freedom and the confidence that they can try more natural things and gain the confidence that indeed their body is there wanting to heal. Or, gosh, sometimes they need the prescription and they're taken care of. There's none of that fear, that same tug of war that I was talking about in the system.
When like, just going your past, as a in your history before being a doctor, how you grew up, did it have any effect on how this has taken place, or is this all something that's happened through your medical experience, like your medical journey?
Again, honestly, I think I grew up, my mother is a wonderful mother, and she is, and I was part of the industrialization of motherhood, right? She didn't, again, back 100 years ago, you had grandma and the aunties that you've got this fever or you've got this abscess or whatever, and here's how we take care of it. We lost the art of that over the last 100 years. And I found that my mom felt helpless at times. Like there were times that she didn't have a telephone at time. We didn't have a telephone when I was little.
Mhm.
And so then it was really her trying to figure things out on her own. And even though I was not obviously aware of it at that time as a kid, it's recognizing the importance of basic ability to take care of ourselves. And so then when I went into medicine, and then you're also able to see the whole spectrum of people that are very poor, all the way to people who have a ton of money. You see everything and how many things people could just take care of themselves. And I remember seeing like little old ladies, of course, they're all afraid of having pneumonia and dying, but they would come in with a simple cold. And I'm like, don't you know how to take care of a cold? And I was like, oh gosh, there's a foundational absence of the understanding of your own body. And that's where I think having that childhood of not having ready access to pharmaceutical treatments or access to doctors or dentists or anything like that is that, gosh, my mom could have done so much. It would have been so much more comfortable to my mother to have had that knowledge to support me through those fevers when I was a kid and not be so scared and having to pray for me because she didn't know what was going to happen. And there's so many people who don't have access to care that is like, you should be able to know how to handle a cold or some of these simple things.
How much of it sounds to me, are you educating people along the way so they're actually benefiting to do that? Like how does that look like? Or are you prescriptive?
No, absolutely. We have so what we didn't mention already is we used to have like 10 or 15 minute visits. The shortest visit time is 30 minutes.
Oh,
here.
wow. So that's 3 times longer.
For the shortest visit, and that's for acute care things, for colds, rashes, or things that would normally be a very quick visit. We actually give 30 minutes for that, so we have time for education. Any med checks or physical exams are 45 minutes to an hour. When we have someone coming in new for functional medicine that really has a lot of complicated issues, we spend 90 minutes with them just to even get to know them. And that's the first part of it. And then we still do labs and we still follow up a whole visit afterwards. So we get to know them and understand. And even then, when we talk about the history and physical, I don't just say, hey, you've got high blood pressure, you've got diabetes. I'm like, what was your childhood like? What were your parents like? What was your relationship with them? Did you have friends in school? Did you have anything traumatic happen when you were younger? When did you start noticing that your health started declining? What was happening in your life at that time? And so you start finding patterns in people's lives and then what their physical manifestations are. And fortunately, because I love family medicine, so we have grandparents down to their grandchildren here. We have generations of families here. And so then you get to really understand the family dynamics of how that might be an impacting behavior in a kid or anxiety in a kid because the parents are going through a divorce or there's something happening as stressors at home or a parent's having financial stressors. So you understand those psychological connections between the generations. Makes a huge difference in how you give care for people and education. Absolutely. And then you can actually, you get to understand like where they're coming from. And that's why I love the home visits the most. When you get to go home to their house and see like what their home is like, again, from either having access to everything or maybe not so much. And you're like, okay, this is how, I had a patient who, she was essentially bedridden. She'd come in, but she would sit at her table all day long. You get to see where they sat. You got to see what was in their cabinets and kind of what their day was like, what their nutrition was like. It's really fun to be able to bring all that into decision-making for them. And this is collaborative decision-making. I have patients who don't want to take care of themselves. They're like, I'm here to love them, support them until they love themselves enough to take care of themselves, all the way to like the person who's like, this little number is just a little bit off. How can I get that more perfect? It's just helping people navigate where they are with themselves.
So it sounds like the vision of integrative medicine is beyond the original spectrum of from ancient to modern. It's also relational, situational, family, spiritual even. Could you talk a little bit about, because that feels like I know that the vision of the new, the new brand is, we're using a stream upstream and downstream. And it's like, it feels to me like maybe a description of like that whole bigger picture, because that really paints a different, so that's one cool thing I noticed from learning about you is there's more dimension. That's really uncommon because it's not just, the spectrum of types of medicine. It's a true full picture because you're describing their work environment, all that stuff. Can you share a little bit about why that's important, or how it can impact why that's probably influencing so much more information on how you address them. And then lastly, I'd say maybe a level of intimacy that you don't expect from a doctor.
Right. Well, part of it came from my personal life, that midlife discovery part that I understood. I was able to see my own physical manifestations, how my body felt, how my brain worked whenever I was undergoing a lot of stress. And how I had to heal myself through that. But then also because I do functional medicine, the functional medicine, for those who don't know, is they call it root cause medicine. And so you're understanding in conventional medicine, you have a cardiologist, a pulmonologist, your kidney specialist, everything goes down to the organ, the eye doctor. But really in functional medicine, we understand that you're really all connected. Your liver is going to be affecting your hormones, for instance. Your adrenals are going to affect your thyroid. So there's all these different connections that you'll make in functional medicine. But what I found is that in my training, they talk about all the environmental toxins, emotional, like family toxins, environmental toxins. They talk about all that stuff, but in the middle, they would have like this spiritual piece. But we didn't really go into it. Like in all my functional medicine certifications, like, okay, they're spiritual, but what does that mean? Like we're not trained in that besides, and you hear mind-body medicine. Mind-body medicine is used kind of loosely, I feel like. And it's obvious at the same time, but how do I really help you navigate your spiritual side? So I found that with functional medicine, I was able to get like 80% people better just by doing the good standard functional medicine. But then there was like about 15% needed a lot more time. And then about 5% of people never really got better at all. And I was like, what is that? This is years ago. I'm like, and then you really, really digging, you understand that they had some pretty significant traumas in their life that they could not get past, and they were holding on and they couldn't see, and they were still in survival mode. And a lot of people, quite frankly, are in survival mode because they're working so hard. The economy is, this, or the world events are like stressing them out, or they're scrolling too much on doomsday social media, the stress, and they're in fight or flight. So I'm like, okay, so then what can I do to help them? It's like, and that's when that was part of my self exploration too. All right, let's explore EMDR or ketamine therapy or somatic work, breath work. There's heart math. Heart math is incredibly studied resource for heart-brain coherence. Joe Dispenza. There's all these different modalities. And for some people, like, oh, that's too spiritual woo. And other people like, oh, that's right up my alley. So then that helped me to bring in that connection. Then as I started really incorporating in that, and some people were like, their nervous system was so shot. I would literally say, you can't come see me until you do this nervous system retraining, because I can't help you. Your body, it does not feel safe to receive any advice I give you. So I would actually turn patients away from me in my functional medicine, directing them towards something that I was like, you need to work on your nervous system first. And I gave them resources for that. And they would often come back to me a whole different baseline. So then when I would be like, okay, now let's work together. Let's work on your gut, because your gut has over 90% of your serotonin is actually in your gut. So serotonin is your happy hormone, right? So most people think it's in their head, but it's really in their gut. And your gut is associated with the vagus nerve. Like they would pray, they'd be like, I'm praying to God, I'm praying to Jesus to help me, like really help. And they just couldn't get over the top. And that's when I discovered the science of psychedelic medicine, for instance. I've done trainings with MAPS, with Maya Treat. She's a neurologist in New York City, on all the different types of plant medicines that can help people and their nervous system reset. And it's obviously, unfortunately, illegal in a lot of states still, but it's increasingly likely to become legal, at least under controlled circumstances, which is fine. But you can go to certain states and get treatments with MDMA or mushrooms legally in some states, or go to other countries. And then I can help people, guide them to that. Or some people microdose. Some people will come to me, hey, I can microdose this. What do I do? How do I help this? And so I help them. Even microdosing and mushrooms have really cool data there's like 60, 70 years of data in thousands and thousands of studies that show that people's PTSD can disappear, depression, anxiety. And I've seen people's entire hormones shift, get normalized, or their autoimmune disease gets better controlled because their body's able to it's rewiring neurons in the brain and in their nervous system that they are finally safe again. That's been quite a journey for me to watch this transformation in my own life and in the life of the practice. Really, the practice, I always joke, is just is an extension of my consciousness. Is an extension of the challenges that I've been through. And even now, I'm postmenopausal. I'm 53. And so being able to, I've been through menopause. How did I manage this? Using acupuncture, herbals, hormone replacement. Those challenges in my life have been the gift for me for this practice, and how to have really compassion for people suffering, and understanding that not everyone's bodies follow the rules or the algorithms that set forth in what they call evidence-based medicine. And the reality is that there's a really cool chart about all the frequencies and gamma rays and ultraviolet rays, and then the visible light spectrum. So the visible light spectrum is like this, and all the other waves are out here. And so for me, the visible light spectrum is kind of like, that's conventional medicine. This is what you see. This is what we know. But then there's this whole world of integrative medicine out there that also has a lot of science behind it. It's just people don't realize it. And being able to incorporate all of that as an option to whatever matches you at this time. And even having been through, it's so interesting. We went with a Paco. He's the medicine man of the high Andes, and his wife, and understanding how they see even plants. Like, we know there's herbal medicines. A lot of people take nutraceuticals, but it's how they see the frequency and the energy of the plant. So they have a plant that has all these benefits, and then you speak into it, you pray into it, and it's for the purpose of that plant having this particular outcome. And so they've been using since Incan times, the ancient Incan times. They're using energy and frequency medicine that most people think, oh, that's a new thing. But it's really, that's the whole ancient and the new. It's like we're bringing in Ayurveda and all these other energy frequency technologies that have really been around for a long time, and bringing it in with the modern peptides, prescriptions, frequency technology. And we're trying to meet you where you are with what your heart feels like connected to and aligned with.
Mm-hmm. It sounds to me like there are a couple of type of ideal patients. One would be someone who's wide open, someone that wants innovation. But maybe there's the third, which is I've tried everything. What's sort of your experience of the type of clients? At this, I'm just projecting based on what little I know about your patient care, but can you share a little bit about that? Because I think people, like someone just listening going, well, I don't want to woo, but they don't realize that actually, if you're out of options, you may want to explore that. I mean, I don't know. What's your take on that?
Well, we've got it all. Like, that's the nice thing is, in our practice, we have the direct primary care or the concierge primary care, where, again, we prescribe antibiotics or antihypertensives. We prescribe medicines all the time. That's not, I'm a medically trained doctor, medically trained. So we have all that access. And so the primary care is like what you would go see your primary care for your colds and pneumonias and flus and rashes and chronic conditions like diabetes, hypertension. So we manage all that. We just try to help you manage it in a more holistic way. And not every one of our patients are like, oh, I want to cure this. Some people are just perfectly content taking their medicines and not going deep dives. They're fine with that. And that's fine. Like, not everyone's ready for that change. It's like am I ready to change? Am I ready to dive in? But then there's the functional medicine where people they've gone to specialists, they've gone to rheumatologists, they've gone to endocrinologists, and they're like, I still feel terrible. No matter how many pills I take, I still feel terrible, and I don't feel like I have my vitality. And so then they're ready to invest in functional medicine, which is looking at your gut, liver, detox, endocrine system, your hormones, thyroid, all the things, the nervous system. And then we have the longevity medicine. Those are for the people who are wanting to optimize themselves. So we have for athletes who are like, I want to feel optimal. I'm starting to get joint pains, or I've got inflammation here. And so we can incorporate peptides when possible. Like, peptides are an interesting shifting thing in the in the world today, but it's pretty exciting. We have hyperbaric oxygen, we have ozone therapies, we have things to help people get to a point where they are achieving at a higher level. So we have We have overachievers, high achievers, where they want to feel like so I'm 53. How do I want to feel better? How can I help these little thises and that's? Because I want to live to 114, living on my own, not in a nursing home. I want to be able to be a grandmother that gets on my knees, and plays with the grandkids. Like so we have the optimization group. We have the people who are like, I feel like crap and no one else has figured this out. Help me figure this out.
Mm-hmm.
And then I have like, hey, I just want to have access to someone who knows how to treat me in a pinch. I want to learn how to take care of myself. I want to feel more empowered in my healthcare. And that's the primary care. So we have like a whole spectrum. And then beyond that is that spiritual aspect that like I said, it's like from primary care to functional medicine, overhaul the health, and then optimizing your health. And then how can I find joy? How can I find purpose in my life? Because again, we're so spread thin with the news and social media and sitting in a desk all day long. And like, oh my gosh, I am now 53. Who am I? What am I supposed to do? And so then I've cultivated a whole system of, for the short word, call them therapists, but they have different modalities from yoga therapy to ketamine therapy to EMDR to internal family systems. And each of those people are going to be able to offer something to the person coming in front of me that says, it's my heart that's left. And physically I feel fine, but like here is where I still feel empty. I still don't know like where I want to go, what I want to be when I grow up, because your 50s, like people, this is not like 100 years ago, like 50s, this is just the start of my next half of my century. And what am I going to accomplish in the next half of my century, like in the next half century where I'm going to be like, what's my place in this world? How am I going to show up as a mother, as a grandmother, as a doctor? How can I be my best? And that's where I want to help cultivate that satisfaction, that soul satisfaction, because people search for their relationship with God, with the universe, whatever people want to call it, with their Jesus, it's expanding your heart right here.
Yeah, you kind of I know the pillars, and maybe to walk us through them, which is empower, restore, and optimize. And why does restoration have to come before optimization? Or walk us through sort of like those banners, because that's a big part of the reframing for your 10-year anniversary. You're really kind of like, because you had this wide spectrum of different things, and I'm obviously, in full disclosure, I'm working with your branding, and we came up with the power, restore, and optimize. Can you walk us through just a little bit of that? Like, so because I think that puts a nice little buckets in everything we just talked about up to now.
It's kind of like the expression, you can't put lipstick on a pig,
Mm-hmm.
kind of thing. You got to go to the source. You got to go to the very beginning. And the root cause is being used like commonly now, like 10 years ago, people didn't know what that meant.
That's actually a meaning, like the root cause of anything gets right to the source of the problem or the source solution, right? Yeah.
It is literally, we are going to, so if you've got inflammation and you've got, let's say you've got autoimmune thyroid disease and you've got joint pains and you're perimenopausal, there's actually some studies that show that women who live in more tribal conditions in the outback, that they don't have as many hormonal issues as a lot of us that are sitting inside rooms with fluorescent lighting, lack of sunshine, lack of being outside. Like I can tell you that last 2 weeks in Peru, I felt like totally different than when I'm sitting in my desk all day long. Like it's a thing. Like we are living in an artificial world that it is not natural to what our body needs. And so going into number one, that how can we do our best to recreate that in this modern world? It's not easy. It might mean that you have to get up earlier and like put your feet on the ground and watch the sunrise for like 15 minutes, sipping your tea. It's like touching the earth. Like there's actually studies, there's forest bathing in Japan, for instance, that I think it's like if you like touch a tree, it's like for a few minutes, your immune system actually responds for a couple hours. And if you spend 2 hours in the forest, you have positive effects on your immune system for up to 7 days or longer. So they have forest bathing places now in Japan, which is so bizarre. Like it's called the woods, but we've gotten so removed from where our bodies are naturally meant to be that it is now a foreign concept to go outside. So it's like getting people back outside and seeing the sun, having the sun literally touch your skin. And like the sun's even important for your vision. Like don't look straight at the sun, but like in the morning, like having the sunlight, not wearing sunglasses all the time, like, or the blue light. Like I have like a screen, like I don't have it on right now, but like I have this over my computer. So, because they found that blue light exposure can affect hormone secretion in your brain. So it really like going down
All the little things. Yeah. It's
all
like,
the little things add up.
yeah. So now's the maybe a good segue to talk a little bit about, we talked about those three, is like that there's a name change. And
Right.
maybe let's talk about the origin story of the name change, because it really embodies this journey you've been on, the empower, restore, optimize. Those are kind of the sections, and you came to this really great conclusion of what this really meant. You touched on it a few times, but maybe now it's time to reveal what this 10th anniversary name change is really all about and what it is.
Dun, dun, dun.
Yeah.
So, we've been at Benton Integrative Medicine. And of course, like I said, when I opened up the business, I thought it was just going to be me. But over the years, it's like, this is not just me. We have an amazing team of providers that offer different elements of that care, that have their different specialties. And so we all want to go upstream. And that's even in primary care. Like upstream for me is understanding those family dynamics, the spiritual, like are there faith-based homes. Or is there an alcoholic in the family? Is there abuse in the family? Like when you have a kid who's wetting the bed and who's having anxiety in school, the problem is not that they have like a psychological problem. They're having a stress response to true like abuse in the home. That's upstream. Like that's the source. And how can we support that family and support that child, right? All the way to the functional medicine. You're living in a moldy home and you need to like become more resilient. You got to make your body more resilient to the mold in your environment. To the longevity is really just how can we age with more vitality, and the source of that is your energy, is your ATP, it's your mitochondria. So we want to be able to support your mitochondria. So everything is upstream. And so because we are offering more, it's like it's beyond integrative medicine. Like Benton Integrative Medicine is now beyond integrative medicine. We're offering so many different modalities for people to choose from that now it's upstream. Like we're doing our best, our very best to support everyone to go to the source of their condition, of their being. And for me, the ultimate being is your soul. It's a lot of people have just soul woundings. And I went through a stressful period and I ended up with Lyme disease, mono, this brain weird zappy thing because I was having some other external situation that was stressing me out. And that was my body's manifestation of that stress, because my brain can't say, oh, I'm stressed out. It's just, it can't verbally say that. So it's doing all these things to talk to me, and your body speaks. So it's recognizing how that we are spiritual beings. So we are soul beings having a physical experience here on earth. And how can we live that in the very highest way? And that's by moving upstream, going beyond integrative medicine, to look at all the modalities to support people's healing.
That's a beautiful explanation. It's like the root cause, but it's beyond that. It's more about downloading, because I know you use a lot of intuition, spiritual aspects. Like it's got a really beautiful expression of not only what you're already been doing over the last 10 years, but where you're going. That's why the beyond is such a nice way of describing it. So it's called Upstream Beyond Integrated Medicine is the new brand name. Congratulations. I mean, it's been 10 years. This is the official sort of like unveiling of that. What's been the hardest challenge of like shifting over this new brand? Like, has there been anything that's been challenging or exciting about the process of rebranding? And you want to share that a little bit? Like, what's that look like?
Well, I definitely appreciate the journey with you. Actually, my husband Kyle and Doreen, she's our chief vitality officer. Just for the listeners out there, we've been working with you, Scott, for a year, I think, pretty much. And I appreciate it so much. Like, honestly, as a business owner, I spent so many years like barely keeping my head above water, learning the business aspect of things, surviving and understanding the psychology of how employees work together. Because in my mind, I'm just like, let's just get to work. Let's get the job done. And not everyone, and understanding the importance of getting everyone to understand what the mission is. And then when it came down to it, like, I understood, I know my mission in my head, but you helped me get that out of my head onto paper. And Doreen and Kyle, of course, my husband and Doreen, like they know the business like I know the business. And so having the three of us get the opportunity to work with you, and you're teasing all this stuff out. And because, as again, I know something here and here, but verbalizing that out in a concrete way, an organized way, helped me to understand my business even more. And that was the inspiring part, is that we're finally getting to focus on the soul of the business. That's the upstream part still. Like this marketing, this branding experience has been like an upstream experience for me, for my business, to say, how can I serve better? Yeah, because truly, like my goal is, that's why I'm taking my name off of it. Like my name is not about me. Like this is about serving our community. This is about, I truly, truly, in my deepest soul, want to be part of creating the new medical system. We've seen that there's a problem with the conventional system and how it's been taken over by corporations. It's lost its soul. And I want to bring the soul back into that. And since I opened up 10 years ago, there's a lot more direct primary cares opening up, concierge practices, because that is the need that people have. And so the upstream effect is bringing the soul back into medicine, just like it is back into healthcare. It's like, it's truly into each person. It's like reconnecting with their soul. And for me, being able to, make more objective descriptions of what's here, and that you've helped us put that together into colors and fonts and things like that. That's been a eye-opening. I did not even understand how complicated this stuff could be. And I thank you for your art of being able to pull that out. And I'm excited to be able to show that. I think that's going to be the more interesting thing, is as we go out to upstream beyond integrative medicine, is like people's like, what does that mean? Is how can we show that we're not losing anything. We're evolving into something more comprehensive, more compassionate. The goal is that as we get this down on paper, it's easier to explain to our staff what is our mission and how are we showing up. And fortunately, like I said, Doreen McCormick, she's our Chief Vitality Officer. She didn't go by COO on purpose. She's the Chief Vitality Officer because we are serving each of our staff members with their heart-brain coherence. We would do heart math with them or breath work with them, regular coaching, because that front desk person answering the phone, I want that to be an extension of the love that we have for our patients and love that we have for our community. And yeah, I think this is the beginning. This is the next phase of me being part of supporting the medical system and giving something new and bringing heart and soul back into it, bringing in the ancient, bringing in the new, bringing in conventional medicine. Like, I'm not anti-medicine. Like we prescribe all the time. And so bringing it in together to make it truly integrative, but not just in the physical sense. Like this is truly, heart, soul, physical, body, the whole life experience. And I hope and pray that people can feel that effort from this process that we've been through.
Yeah, I mean, I like to think that it's more coherent. I mean, it's really in a description, it's really embodying everything that had to be described further down in the communication. And hopefully this brings a bit more of an excitement of an energy, because, when you're talking about, you wanted to make sure there's heart and head math coherence and within the group. It speaks to this concept called brand mantra, which is, what is the feeling we want people to have in every interaction with now upstream? What is that feeling you're hoping that people get when they come? Because we talked at the very beginning of being seen, not being rushed, on all these things. Maybe if you can kind of encapsulate, because now somebody's going, this brand is representing a promise, and the promise is your vision. Can you share that sort of feeling and the vision of where we're going?
When people come here, I want them to feel safe. I want them to feel heard. I want them to feel that they are part of the collaboration, that we're guides. I am not the boss. I'm not here to tell you what to do. I'm here to guide you on what you think is right for your journey within, obviously safe reasons, within safe limits. I want them to feel curious, and that they can ask questions and feel respected, and that curiosity is honored and considered in the treatment plan. I want them to trust that if we don't know the answer, we keep on searching. Like I'm getting another fellowship this year. Like I'm always learning to see what's the cutting edge, and that this place is a place that they can come and feel like that they are setting themselves up for the opportunity to heal in the highest way, and in the most they can move forward knowing that this is a place that if they fall off a little bit, they can come back and get the extra support, or potentially never need to see us again because they're well and that they've learned what they need to do to honor their bodies and trust their divine ability to heal.
Brilliant. And so maybe wrapping up, now tell me what's next. Like what now that we're launching this, what can people expect? Is there changes? And then lastly, is there anyone you want to thank or give credit to? Because that's really putting a nice little bow around this amazing goal of reaching 10 years and doing such a great brand shift. So,
well, I would say definitely God. There's been so many times throughout that it was just pure faith and knowing that God's using me and to do work for the community and for this world, and my trust in that. I have a lot of faith that, and in moments that it was really tight, like I was like, nope. God's got me. He's got me here for a reason, and things would just be taken care of. So that first and foremost. And my husband, of course, he's my soulmate. And Doreen McCormick, she really came in. I had some business challenges halfway through, and it was just like I almost got eaten alive by my own business just from I didn't know, like we're not trained in business. And she just has come in and just helped me to extend that mission and that love forward. Thankful for, of course, my family. And, my family's been in North Carolina since the 1600s. And so I have a long history here. So I'm thankful for all that. But we're going to be like rolling out the ideas of the Upstream Beyond Integrative Medicine. We're going to start like August 5th is when I opened my doors in 2016. And we'll have a big open house in March. And we'll be having giveaways and education and opportunities to try the new modalities that we have here. They're not going to be getting less, that's for sure. They're going to be getting even more. And I'm excited to offer all this. And like I said, I took my name out on purpose. Like it is not me. This is the team. This is the new way of doing medicine that we are going to be showing the world how we can do it better.
Awesome. Well, thank you. I think that is a great wrap up of congratulations on your 10-year anniversary, and we look forward to the next 10.
And thank you, Scott, so much for this incredible year. Like I said, it's Kyle and I have definitely said, wow, it's like even this has felt like this is our upstream soul searching for the business, spiritual experience for the business part. So thank you so much for that.
Oh, you're welcome. All right. Congratulations.
Thank you.